So I'm here with osteopath Albert, and today we're going to be talking about cervical radiculopathies. This is where some nerve irritation in our neck can start to cause radicular pain into the arm. And for these patients, it can become very, very uncomfortable for them to sleep. So if I wanted to test Albert for a cervical radiculopathy, you would perform a nerve stretch. So this is where I would, for example, take his arm and I would stretch, for example, the median nerve or the radial nerve or the ulnar nerve to see if it reproduces symptoms. And to increase his symptoms, whilst I would do that, I would ask him to maybe lift his head and take it to the opposite side. So we want to actually do the opposite to enable him to rest comfortably with a cervical radiculopathy. So I'll show you how. First of all, we want to create a slight kink in the lordosis of the cervical spine. So what can be quite comfortable for patients is if they have a pillow underneath the small of their neck, and that will then exaggerate the arch, exaggerate the lordosis in the neck, and that will enable them to sleep more comfortably because the nerve is no longer being stretched. But as well as this, what we can do is place something in between his arms for him to hold on to. So in fact, if I just grab a pillow. So from here, what we can do, and this can have different responses to different patients dependent on which nerve is being irritated. But sometimes by them hugging a pillow, that can feel more comfortable for them, especially if they start to hunch up into the shoulder, so create a little bit of slack around the tissues of the superior part of the shoulder. Or some patients might actually like to lay their arm down by their side but have something to rest on. And once again, sleeping with a cervical radiculopathy can be very, very difficult. If this enables the patient to get an extra hour or 2 hours sleep at night, then it will make them more resilient to the pain and it will better help them on their recovery. So that's how you sleep with a cervical radiculopathy or even neck pain.